Good evening, guys. I've got discussion D for you. Now we're discussing the Affordable Care Act, quote Obamacare, price hikes and premiums. Okay, so we're going to go through that tonight for D. So please join me for the presentation I made for you. Please enjoy. Okay, what the headline means. The Affordable Care Act enhanced premium tax credits, temporary subsidies that dramatically lowered monthly insurance costs for millions have expired. Without them, premiums are spiking, leaving many Americans facing higher bills or losing coverage altogether. What expired and why it mattered? The policy. These subsidies were introduced during the COVID-19 pandemic to stabilize households and ensure access to health care during a crisis. They were later extended through the Inflation Reduction Act. Two key features made them transformative. Lower monthly costs. Millions of people qualified for reduced or even zero cost premiums. Extended eligibility. For the first time, individuals earning more than 400% of the federal poverty level could receive assistance. This combination fueled historic enrollment gains within nearly 24 million people signing up for ACA plans in 2025. Timeline and political contexts. Key dates. December 31st, 2025. Final deadline for Congress to extend the subsidies. December 19, 2025. Republicans left for holiday recess without a deal, effectively allowing the subsidies to lapse. The political backdrop was turbulent. Democrats largely united in pushing for an extension, while Republicans were divided between hardline opponents of Obamacare and moderates worried about backlash from constituents. The fight even triggered the longest government shutdown in U.S. history. Immediate effects on people and enrollment. Practical impact. Premium hikes. Without subsidies, monthly costs rise sharply, especially for middle income families who had benefited from expanded eligibility. Coverage losses analysis warn millions could be priced out of the marketplace, reversing years of progress in reducing the uninsured rate. General 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 generational divide. Young adults are projected to experience the steepest increase in uninsurance rates, which could destabilize risk pools and drive costs even higher for everyone. Deadlines and short-term options, enrollment timing. To start coverage January 1, 2026, people needed to enroll by December 15, 2025. A second window remains open until January 15, 2026 for coverage beginning February 1, 2026. This means individuals still have a narrow opportunity to secure insurance through insurance, though at higher costs than they faced in previous years. Broader implications. The expiration of subsidies is more than a financial issue. It reshapes the healthcare landscape. Equity concerns. Marginalized and lower income communities will be disproportionately affected, widening health disparities. Policy crossroads. The lapse forces Congress to confront whether the ACA marketplace can remain viable without enhanced subsidies. Public health risk. Rising uninsured rates could lead to delayed care, worsening outcomes, and higher uncompensated costs for hospitals and states. In short, the headline signals a turning point, the end of a pandemic era. Policy that extended access to affordable health care and the beginning of a new political and economic battle over how or whether to preserve that process. Okay, folks, that's your D for the night. I will see everybody tomorrow for shows. Until then, Gator Wellness, take care, folks.